Good morning, everyone. So today's class is going to be focused a little bit more on an issue that I have related to the neck. I've had a couple of people send me messages about this over the past few weeks or months. So I wanted to have an opportunity to go into it a little bit deeper. I get an arrhythmia, heart arrhythmia on a regular basis. I have for years. I have a theory that the cause of the arrhythmia is not a cardiovascular or electrical issue associated with the heart, which is a possibility, but it is my theory is that it has to do with issues in my neck where I have immobility through certain vertebrae based on an injury history. And because of that, I have muscles that go into bracing patterns that get tight. And from those muscles are where the peripheral, the nerves of the spinal cord turn into the peripheral nerves that then feed down the arms, or the vagus nerve more specifically, which feeds some to heart rate and digestive and other functions. And so my theory is that when my neck gets tight, I get impingement on the vagus nerve, and then that vagus nerve, that impingement creates stimulation within the nerve that then kind of flicks on my heart arrhythmia. And so I've been playing around with more neck mobility, and what I have learned, or what I've kind of discovered, is that the more I work on my neck and the relationship of how my neck moves through the rest of my body, that I get the arrhythmias less frequently, and when I do get them, I get them for shorter periods of time. I'm able to get out of them fairly quickly. So I want to teach this class not as a way of curing or solving the problem, but as an accessory supplemental way to work with it while you're also working with a doctor or medical professional on what other underlying issues could be coming from it. So what we're going to start with as an assessment is kind of an interesting assessment. This is an assessment that I have for myself. Because this is one of the positions that I find gives me the most relief. We're going to start in a prone position, lying on the floor, bringing arms just straight to the side comfortably, and letting the head rest to one side, and kind of seeing how far will your head rest, and assessing how does it feel. Is it uncomfortable? Is it tight? Is it restrictive? Is it painful? If it's painful, then I want to be careful about how far into it I want to go. I want to make sure I'm not going into a painful position. But I want to spend about 15. Is there a question?
Yeah, on our screen, we don't have a good full picture of you.
Ah, I have not adjusted my screen. I also need to make sure that I have spotlight so that you guys see me in the video. All right. Better? So I'm in my supine position. My head is turned to the side. I don't want to be in pain, but I want to assess, how much tension, stress, strain there is through my neck. In this position, and I'm spending about 15 to 30 seconds just breathing and softening into it, which may expand a little bit upon that tension in the neck. And after about 15 to 30 seconds, I'm going to switch to the other side. And as I come to the other side, what I notice is it's a little bit harder for me to get into the same position. I don't have the same level of mobility in my neck. When I generally do this when I'm in bed. This is a part of how I kind of wake up in the morning, because it helps give me a stretch through the neck. I will lay in this position for a minute or two with my head on each side. But right now, I really want you to just kind of get an assessment of what is the difference between head turn to the left, head turn to the right. And we're going to come back. Hopefully, I'll remember to come back to this at the end of the class. If I forget, please somebody chime in and let me know. So that we can see if we get some improvement. So with that, now we're going to come into, I'm going to really focus on neck mobility through lots of different positions today, because I don't want to just work my neck by itself. I want to relate my neck to how other positions of my body feel. So we're going to start with our wrist mobility, just to get that wrist and foot mobility to get it out of the way. So I want to spread fingers out wide, really connect palms and fingers to the earth, and start to get that nice forward, backwards, rocking, feeling into the left wrist compared to the right wrist. As we're doing this, we can kind of continue to do a little bit of just gentle turning the head side to side, lifting the head up, looking down, kind of checking into the neck and how the neck relates to the position that we're in quadruped at the moment. After doing about 5-10 reps, we'll turn the fingers out to the side and start moving side to side. And even as I'm doing this, I can bring in a little bit of neck assessment. You know, I'm paying attention to my wrists. I'm making sure that I got my connection of my palms to my shoulders, but I can also turn my head side to side as I move side to side. I can reverse the side that I'm actually moving my head to look away, or I can look towards, depending on which side I'm going. So I'm noticing as I look towards, it feels pretty good. But when I move and I look away, especially when I'm moving to my left and I'm looking to my right, man, that brings up something in the right side of my neck. When I do it the other direction, it is not there. So I feel something through my neck on the right side. So that is a part of my assessment. I'm kind of noticing how my neck is functioning in these positions. Then turning the fingers back towards the knees. Again, the closer my hands are to my knees, the less intense this is, and the further away, the more intense. And just slightly rocking back into the heels, keeping the palms engaged and connected to the floor. Being real gentle on this, it can be an intense stretch. I don't want it to be massively intense. I want it to be comfortable, but I want it to be nice and juicy as well. And then flipping the palms over, getting the back side of the palms in. Again, this position can be uncomfortable in the wrists, so I may start with just reaching and extending the elbows to that mild discomfort without going into pain. If you are able to go full extension, then we get into the nice rocking back into the heels. And even here, you know, I'm still just playing in, you know, with moving my neck, seeing if there's anything in particular about this position of what I'm doing that comes to my attention. And then we're going to switch our attention now to our feet, tucking the toes. As I'm sitting back into my heels, I want to feel that load stretch primarily on the big toe, which means I want to make sure that my heels are parallel and not turned out from each other. If my heels are turned out, I'm not going to be on my big toe as much. I'm going to be on the outer toes. So I want to keep the heels straight up towards the ceiling as I rock back and forth, and comparing that right big toe to the left big toe. This is an important assessment for our neck. If you feel one big toe is stiffer and tighter than the other side, I guarantee there is a connection between that big toe and what you're feeling in your neck mobility. As we're moving back and forth, we can then start to windshield wiper the heels, letting them roll out. Now we can get into those outer toes. We can let the hips kind of wag with that as well in order to get into that nice loaded stretch. And again, I'm noticing a little bit more stretch to the right side outer toes than I do on the left side. Just feels a little bit more tight and restricted. And we'll let the ankles go straight and do the same, rocking back, feeling into the front of the ankles now. Seeing how far back you can go. Can you get your hips to your heels? Can you sit up tall on it? Or is it too tight and restricted? If it's too tight and restricted, then we're just moving into it to the point of getting into that stretch, a little bit of strain without going into pain. And if we can get all the way in and getting a little rocking side to side, just getting that nice loaded stretch, making sure, seeing what is the mobility through the front of the ankles. All right, so now I'm going to come in a little closer so that we can work specifically on neck mobility. So with neck mobility, I want to have my hands reaching down. I want to keep my shoulder blades drawing downward. So I want to watch out for shrugging. And so what I find is helpful is either clenching the hands and drawing the palms together, drawing the elbows together and reaching down. Now that position might be really challenging for some people, so we can also do this from an inverted position where you're loading the palms down. And so that's the position I'm gonna take for right now, based just simply because it's a little easier for me to maintain it while I'm teaching this. So I'm reaching down, I wanna get tall through my spine, so I'm lifting my sternum. I'm also lifting through the top of my head. I'm trying to see how tall can I get my spine. And from this position, I'm gonna start turning left and right as if I'm looking over my right shoulder and then looking over my left shoulder. And I'm seeing what is the difference. I can go a little further to my right. I feel like I can't go quite as far to my left. And I'm not trying to fix it, but I am exploring it. I'm trying to engage in the little bit of stretch that takes place. Seeing if I can get a little further without going into pain. Real important on this. We do not want to go into pain when we're doing neck mobility. So any of the movements that we're doing today with neck, I want to stay out of painful range of motion. If you're feeling some pain in the neck, please voice up. If you're watching this in a video, just stop where we are and send me a message and let me talk about it with you first. So as we're going side to side, we're doing 5 to 10 reps. And next I want to let my head tilt as if I'm dropping my ear towards my shoulder, and then with my opposite ear, I'm pretending I got a piece of string that's pulling me upwards. So I'm letting my ear drop and lifting that opposite ear straight up to the ceiling, coming back to neutral, head drops to the other side and lift. And so I'm feeling this nice stretch through the side of my neck. And I'm comparing what's the difference on each side. As I lift my right ear, I'm feeling massive tension. In comparison, when I lift my left ear, I feel, it just feels normal. So I have a significant difference in this side compared to this other side, which again, I relate to why I get an arrhythmia. So I'm moving into it, trying to get that movement, this right side to move a little bit more freely, but I'm not trying to force it. I want to be very careful about forcing it. Next movement we're going to go into is glide. So with glide, I want to keep my cheekbones on the same plane. I don't want my head to tilt as I move to the side. So this is a movement that's very helpful to do in front of a mirror. It may be difficult to do while watching me, but as you come back and work on this later, you can work on, can I keep my eyes and my cheekbones on the same plane? And it doesn't have to, it's, you know, you may not move as big as I do. You may find that your movement is really small to start with, and it takes time to get this full range of motion. It took me close to a year to get as much range of motion as I have. Now, as I'm doing this, as I go to my left, it feels pretty free. As I go to my right, I have pretty good range of motion, but I feel that tension in my neck again. So again, this is all data points. I'm keeping in mind where I'm feeling it and what positions I'm feeling it. All right, so next, we're gonna get on our backs and we're gonna do a little rotation through the rest of the spine. So laying on our backs, we'll do our supine hip rotation. Arms are coming straight out to the side with the palms up. Hips and knees are at 90 degrees. And I'm just gonna start by letting my hips slowly rock side to side. I wanna start really slow here. I'm just getting some easy mobilization of my spine. I want my shoulders to be soft. I don't wanna feel like I have to brace anything to keep me from falling over. If you feel like you gotta brace, then you're moving too far. And as I get this nice little oscillation coating the synovial joints of my spine with fluid, I can start to let it get a little bit bigger. I'm still trying to keep my shoulders soft. So I'm kind of seeing what point as I let my hips rotate, At what point do I feel my core get that stretch and my shoulders want to engage or get pulled off the floor? Can I find that edge where I can keep my shoulders soft without them getting lifted off the floor? And as I'm doing this, I'm paying attention to the difference of each side. As I'm moving to my left, I got a nice big range of motion before I feel any significant stretch. As I go to my right, I feel that way. As I go to my left, I'm noticing a tension in my back fairly early on. And I also notice that it's hard to keep my hips even, my knees square. My top knee wants to stay behind, mainly because that tension in the back won't let my hip rotate. So again, super, super valuable information there. Now, as we're getting into this a little deeper, now I want to start to actively press my shoulder down and see if I can go a little bit further. I can now move into that stretch a little bit more. I don't want to go into pain. I want to be very, very mindful, not that I'm not going into pain. And now we can start to also bring a little bit more awareness back into our neck. As I'm rotating my hips to the left, I can see, how far can I turn and look to the right? As I go to, my hips go to the right, how far can I look to the left? Does that bring up any kind of awareness of tension or strain patterns in your neck that are related to rotating the hips? We can also look the same direction. So as my hips turn to the left, I'm looking to the left. And as my hips move to the right, I'm looking to the right. I'm not finding anything super noticeable about those particular positions, but you might. So now we are going to get out a staff. Sorry if I did not mention that ahead of time. So if you need to grab one real quickly. And we're going to do some shoulder mobility and neck mobility with the staff. So I'm going to start. I want to have a nice grip, round shoulder width apart. I want to be pretty solid in my grip. I kind of like imagining that I'm trying to break the staff in half, but I want to have some tension as if I'm bending it. Now I'm not actually bending it, but I am feeling my elbows rotate, and I'm putting just a little bit of strain into it as if I'm bowing the staff. And then from here, I'm going to just let my elbows reach as if I'm trying to pull my elbows behind my ears. I want to watch out for my ribs sticking out. So as I do this, I don't want this action where my 12th rib juts out. So I want to keep some tension in my core at the same time that I'm pulling back. And I'm just kind of noticing my shoulders are a little tight, mainly because it's first thing in the morning. But for the most part, they feel pretty smooth. Now, as I bring them up and I'm pulling back, I'm going to start just slight pulsing back and forth from this end range. And I can come back and start looking at my neck again. So as I'm pulling back, I can also turn my head left and right. And as I turn my head to the left, feels pretty good. When I turn my head to the right, it feels good until I get to that last bit of the end range. It's not painful, but there's just something about it that feels off, feels tight. There's like a point that I can't get to. So I'm making these notes on of how my body's functioning. Then bringing the staff behind, I've got my palms facing the back wall. Again, I'm reaching down and I'm still bending the staff. I'm still trying to break it. And then lifting the elbows up towards the ceiling. Nice, easy movements. We can bend the hips a little bit, and that may help get it higher. What I want to watch out for here is I don't want my shoulders to roll forward. If anything, I want to try to keep my chest as open as possible as I lift my elbows up towards the ceiling. And we can even add in just a little bit of like neck mobility of just seeing, is there something interesting when I look to the left and right? And for me, nothing super interesting on that one. Then flipping the palms over so that the palms are facing the forward wall. And doing the same thing, lifting the elbows, keeping the chest nice and open. I'm also paying attention to how my shoulders feel. I actually have some tension in the left side of my neck or shoulder, kind of right underneath my clavicle. And it's been there for a week or so. So that's something I'm also taking some notice of. And again, as we lift up, we can start to look left and right. And since I'm feeling that area in my left clavicle, as I turn my head to the right, I'm noticing that there's some pull on that. So I'm now relating a little bit of what's going on in my neck specifically to another tension area underneath my clavicle on the opposite side. So that can be very, very helpful information. So we're going to go ahead and put the staff to the side. We're going to come back to our quadruped position, and we're going to go into some cat-cowl work. So I want to get right into the spinal wave. We spent a lot of time doing pelvic tilts, but for the sake of time, I'm going to kind of bypass that. So I want to start with this idea of my pelvis as the handle of the whip. My spine is the wave of the whip. So I want to generate the movement of the cat-cow from my pelvis and allow the rest of my spine to explore the wave pattern. So as I tuck my pelvis, I'm going to feel this wave move up through my low back as it gets to my upper back, reaching through the floor. And then as it comes across the top of my head last, I'm trying to touch my tailbone and my forehead at this imaginary point in the middle. And then moving the pelvis the other direction, feeling that wave, feel that opening of the spine, the chest moves to the floor, and the head whips up last. And going nice and slowly and smoothly. And as you get to about the third, fourth, or fifth one, we can come back and look at our neck again. And we have two positions that we can look in the neck, at the neck. So I'm in my cow position with my head up, and I can look left to right, see how that feels. I can also do my dropping the ear to one shoulder and reaching the other ear away. Now, since I'm in a quadruped, I'm not reaching up towards the ceiling, I'm reaching to the wall in front of me and going side to side. And I'm trying to do this from the cat position. And then as I come into the cow, nice and big cow, seeing if I can feel the stretch from my tailbone all the way to the base of my skull. In this position, I can start turning my head, rotating my head left and right. My head is facing down now, so this is a different, kind of a different movement. And the interesting thing is I don't feel this on the right side anymore. I feel it more on the left side. And then I can also do the ear tilt. So I can bring my ear, one ear towards my left ear towards my left shoulder, and then reach my right ear towards the floor. And I'm not doing this to I'm not being forceful here. I'm just very lightly exploring. And again, in this position, I feel this more on the left side, and I feel it more related towards what I was feeling in my clavicle. So again, what's going on in the neck is not necessarily going on in one location. It's probably a combination of places, which is why I want to get deeper into my assessment with it. So now, from our cat-cow, we're going to go into some child pose to explore. So I'm bringing my hands forward, getting that nice sticky gecko hands. Elbows are active, not passive. Reaching the sternum through the shoulder blades and coming right back out. I want to rock in and out of this position, but each time I'm seeing if I can go a little deeper, a little more active in my hands, and explore how does one shoulder feel compared to the other shoulder. And as we do this a few times, then I'm going to get to the bottom, and I want to have my gecko sticky hands. I'm going to push them forward, but because they're sticky, they're not going anywhere, so my shoulders raise up towards my ears, and then I'm going to pull my sticky hands, and they're going to draw my shoulder blades down my rib cage towards my hips. And I'm going to go back and forth kind of seeing how does that feel between the scapula and the rib cage. Take notice of your elbows. I want to keep the elbows actively straight. You may find that as you pull your shoulder blades down that they want to bend a little bit. Try to resist that. See if you can keep them actively straight as you draw down. Can you get a little bit more range in how far your shoulder blades go without the elbows bending? Now, we're in our deep child's pose. I'm going to have you kind of rock out of it just to give your shoulders a little bit of a rest, and we're going to go back into it, and now we're going to assess the neck again. So from my child's pose with my hands overhead, I'm going to look left and right again, and just seeing if there's anything that brings to awareness either in my shoulders or my neck. I'm going to do the same thing by reaching my gecko hand, my sticky hands forward so my shoulders come up to my ears, and look left and right. And then I'm going to pull so that my shoulder blades draw down my spine as far as I can and look left and right. I'm not getting very much in this position. You may find something that draws your awareness. I'm not, so I'm moving on. So now I want to add in a little bit of stability into what we're doing. So we're going to go from our child's pose, quadruped, and then I'm going to lift hips, and we're going to go into kind of a modified bear crawl position or down dog position. So as I lift my hips up towards the ceiling, I'm reaching my palms away, my sticky hands, I'm reaching them away. I want to keep my knees bent. I want to keep my knees very bent for a while as I reach away, because this gets me into a similar position in my shoulder as we were in the child's pose. And once I get into this position, we can play a little bit with reaching the heels and straightening the knees so we get some stretch through the back of the hamstrings and calves. We can even do some gas pedal, reaching one heel and then the other heel back and forth to get that night, just to compare how does that right side feel compared to the left. And then we'll bring it back up to our shoulders. I want to reach my gecko hands forward so my shoulders come up to my ears, and then allow my shoulder blades to drop down away from my ears and move back and forth. And then again, since we're in this other position, I want to explore my neck. So I'm going to do some rotation of my neck. I'm starting out with my shoulders drawn down along my rib cage towards my hips. So I have lots of free space between my shoulder and my neck. And then I want to push and reach away so that my shoulders come up to my ears like earrings. And then do the same thing as I rotate my head side to side. Does that elicit any kind of interesting stretch or strain in the shoulders or the neck? All right, so now we're going to come into our Shin Box position. And from Shin Box, I want to just kind of start going side to side. Well, first thing, I want to see how does it feel in my Shin Box. Again, I always come to the same side. This is my easy Shin Box side. So when I come to the other side, it's a little tighter. I've done a few of these already today, so it's not as bad as it was when I first did it, but I feel a little bit of tightness in the left anterior inside of my left hip and right side low back. And I'm gonna make the assumption that this stuff is also related to my neck, although I have not made the connections yet. And we're gonna go side to side with this. Going from one side, I wanna sit as tall as I can in my spine, and then to the other side and sit as tall as I can in the spine. I want to compare, how does it feel on one side? Again, my left side Shin Box feels super easy. My right side Shin Box, it's like, my body wants to lean a little bit. I have to really fight that resistance in order to get tall. I feel some stretch that happens when I do that. So as we're doing this side to side, now we're going to start to add in a little bit of our pigeon work. I'm reaching my sternum through my knee, reaching my hands, seeing how that feels in the hips, and going side to side. I want to compare that right side to the left side. which for the most part, they feel fairly even this morning, which is good. They do not always feel that even. And as we do a few of these, and now I'm going to start to let that back leg open up more. Change the position as I'm exploring both hips. Again, as I go to the other side, doing the same thing, reaching that back hip. I'm noticing that this hip, as I open it up, it's a little tighter on this side, especially as it's kind of out to the side. It does not feel quite the same as when I do it on this side. This side feels fairly easy. And we'll continue to open that back leg up till we get closer and closer to a true pigeon. And what we're doing as we're doing this is just simply exploring various positions of the hips. How does that back hip relate to the front hip? How does the front hip relate to the back hip, kind of thing? Until we get to as close to a kind of what we would consider a more true, proper pigeon pose. Although I like to make sure that I have a nice open knee. I don't want my knee to get closed. I want to keep this angle close to 90 degrees, which means you may have to lift up to find that position. And I'm reaching that back leg down because I also want to feel some stretch through the front of this back hip. So again, as I get to that open knee, on this side, I got to lift up just a little bit higher, and it's a little harder to feel the front of this back hip. I'm going to do one more on this just to feel like this needs a little extra love today, especially this particular side. And now we're going to do a little bit of Shin Box to knees. We're doing lots of mobility today, so I'm trying to add in a little bit of stability work. So from Shin Box, I want to drive through the front of the back of the front knee and the front of the back knee. Driving up, coming up, feeling that nice stretch through the front of the hips. I can even play around in here, like exploring the hips a little bit, seeing how does that feel. I got a little bit of tension in this right hip that I feel like can just get a little bit of movement to get it to loosen up some. And then as I come down, I want to drop slowly, and I want to kiss the floor with my bottom at the last possible moment before I come to the other side. Again, driving through the knees, finding that position to get that nice stretch, and even moving around in the hips just a little bit. This side doesn't feel quite as tight, at least the left side doesn't. And we'll go back and forth 5 times or so, getting that nice drive, kissing the hips to the floor. Same thing on the other side. If you need to use your hands, I'm not using my hands as I transition. That you may find that that's too challenging. If the hands need to come down a little bit, that's fine. I don't want to get too rushed on this, especially on my descent. I want to really control this, kiss the hips to the floor at the last possible moment. I want to see if I can feel that stretch in my glute as I'm descending back down to the floor. So we'll go ahead and come back to our Shin Box, and now I'm going to put my hand down on the floor, and I want to do a little bit of shoulder explore and bringing it back up to neck explore. So I'm letting my spine soften to the floor. As it softens, I feel my shoulder get raised up towards my ear, and then I'm going to reach through my palm, pressing and lifting my spine up to the ceiling so I have more space through this upper part of my shoulder, and letting the spine soften, and then reaching and lifting. And as we're doing this, I can start to bring in my neck mobility. I can look left and right, especially as I drive away. How does that feel? As I soften and I look left and right, how does that feel? I have a lot more freedom of movement when I'm in this soft position as opposed to when I'm driving and lifting, where I feel more strain at the neck. And I'm gonna go ahead and bring in a little bit of this dropping the ear and lifting the opposite ear. And I'm gonna pulse a little bit. I'm reaching through my palm at the same time as I'm lifting through my ear, so I'm getting a little bit more traction into this movement than I had before. I want to be very gentle here. I don't want to force this. I'm only going to do 3 to 5 reps. And then I'm going to soften, and I'm going to do the same thing on the other side, reaching through that ear. And man, I'm feeling that right side on this neck, on this particular movement. Even though my right shoulder is not loaded, I'm feeling that. And then we'll switch to the other side. That hand's nice down, nice and firmly grounded through the palm, letting the spine soften so that the shoulder comes up to the ear, and then reaching, lifting the sternum up tall. And moving back and forth on this. And I can right away, I'm feeling some tightness and tension more in my mid to upper back. I'd say probably my 7th, 8th rib, where it attaches to my spine, just doesn't feel like it's moving a whole lot. Feels a little tight right there. Doesn't feel bad, not painful, just something I'm noticing. Feeling that reach as I draw down, and then adding in some neck mobility, turning side to side. And then allowing that softening and doing the same thing. And interestingly enough, I don't feel a whole lot in my neck. And so now as I get tall, I'm gonna reach, drop my ear and lift my right ear up towards the ceiling as I'm reaching away, getting this little bit more noticeable counter tension as I'm doing this lifting of my ear. And again, interestingly enough, in this position of being loaded, I don't feel this quite as much as I did when I was on the other side. And then I'm going to switch ears, letting the other ear reach up towards the ceiling. So when my right hand is loaded to the floor, this particular movement of my neck feels pretty easy. But when I'm loaded on my left hand, I notice my right side is significantly more tense. Again, just really, really interesting information that I will, something I will add into how I explore my movement going forward for the day. So now we're going to come back to the other side. And we're going to do a little bit of long arms, do some spiral work. Hopefully we have time to get through this. So we did these last week where I kind of want to play with rotating my hand from palm down, keeping load in it as I come to the side of my hand. As it flips over, my elbow comes to the floor. And as I spiral back, I press out through my hand and my elbow goes straight. So I'm spiraling my hand. That brings my elbow to the floor. I'm not trying to just find the floor with my elbow. I'm spiraling the hand and that bends the elbow. And then I'm spiraling the hand and that extends the elbow. And as I spiral the hand, the elbow comes to the floor. Now I'm pulling my elbow into my side body to see if I can find the floor with my shoulder. And then I'm driving through the elbow, spiraling the hand to go into elbow extension. And I want to do that a few times. This is adding in just a little bit of stability work into the shoulder and neck since we're adding in all this mobility. So we'll do about 3 to 5 of these. I'm doing 3 since I'm talking so much. And we're going to come and do the same thing on the other side. So again, in my shin box, hand comes down. I want to play with this spiral. My spiral, I want to make sure I have some pressure, some load of my body into my hand, as much as I can have without pain or without losing balance. And as I spiral my palm upward, my elbow finds the floor. And as I spiral back, it extends my elbow. And I want to play with that rotation, how my hand impacts my elbow. And as we're doing a few of these, now that as I come to my elbow, I want to pull my elbow into my side body and see if I can find the floor with my shoulder. And then as I drive the elbow and spiral the hand and go fully onto extension, and I'm going to do that about 3 to 5 times. Pulling it all the way in and driving, pressing out. I find that if I do too much mobility and I don't add some kind of low-level stability work, that can actually make things feel a little tighter afterwards. So I want to add in just some low-grade stability in order to kind of calibrate the system after doing a lot of movement work, a lot of mobility work. All right, so now we're going to get into an inverted position. And this is kind of where we started off with our neck mobility. So hands are at the side, reaching down through the floor. And I want to get a little soft in my spine, letting my spine round so that my shoulders come up to my ears. And then drawing down through the floor, lifting my sternum up nice and tall to the ceiling. And going back and forth on this. Drawing down, lifting up tall. And as we do this at the bottom, as I'm in this soft place, I can kind of look a little bit softly left and right just to see how is my range of motion. I want to make sure it's not painful. And then as I draw down, lifting the sternum up tall, I'm doing the same thing. Rotating. Since we did these earlier, we can start to get an assessment of, does this feel a little smoother? Does it feel a little easier? And then we're also going to do our dropping the ear and lifting up to the ceiling again. Does that feel a little bit, do you have a little bit more range of motion? What I'm now starting to notice is that that right side actually feels more mobile. It actually feels free. My left side, as I lift the left ear, I don't feel a stretch and I don't feel it move. And that's more interesting, the fact that I don't feel the stretch and I don't feel it move, than all of the noise that I've been hearing on the right side. The right side has been giving me lots of feedback, but this left side, not having any sensitivity, knowing that it is related to what I'm feeling underneath my clavicle, I'm more cued in on that than I was on what I was feeling actively on the right side. So, and then we're going to add in one more thing with just going into our side to side again, adding in that nice glide, keeping the cheekbones as level as possible. Again, I'm still reaching through the floor, driving my chest up to the ceiling as I'm going side to side. Nice. So let's come back to our position on the floor, laying on our stomach. Arms are softly at the side. Head is turned as far as you can go to one side without being in pain. And let it sit there for about 15 to 30 seconds. Taking some nice deep breaths and kind of softening into the position. Noticing any feedback that your body gives you. Does this feel does it feel kind of off? Does it feel unsafe in any way? And then we'll turn the head to the other direction. And again, noting, does it move as easily? Is there more tension? I'm still feeling that this side is not the same. This is not like the other. But it does feel a little bit more mobile than it did earlier. And so I will be curious, once we're done, about any feedback that you may have noticed from the beginning of the session to the end of the session specific to neck mobility. So let's get into a nice, seated, comfortable position. Go ahead and close your eyes and take a nice, deep, full breath in through your nose and out through your mouth. In through the nose as deep as you can. Really try to bring in that breath and inflate your belly. I want to fill up the belly as big as you can. And not just through the front of the belly, not just through the belly button, but also through the side of the belly and into the low back. Can you feel that inflate like a balloon, not just in one direction, but all directions at once? Big inhale in, hold at the top, and full exhale. As you exhale, draw the navel into the spine. Feel that breath fully express every bit of it, and then right back into a nice, big, full, cleansing belly breath. Hold at the top, full exhale, navel to spine. And do a few of these. And as we get into this and you start to feel your shoulders soften just from taking these nice full breaths and these full exhales, I want to bring my attention back to the neck. So we're continuing to breathe in deeply, filling up the belly. But also start to notice your neck as you breathe in. Can you feel that inhale turn in? Is there a stress or a stretch or a strain pattern in your neck or in your upper clavicle area, in the upper chest? Do you feel that if there's an inability for that inhale to fully express, can those ribs not move out in that particular area of the neck and the upper shoulder region? And if you're feeling anything specifically in that area, start to bring in the awareness of your breath as if it's light energy into that space where it's not moving as well, and see if you can just bring some attention of movement, and does that start to open it up a little bit? I want to make sure it's not painful. I want to make sure it's not anxiety producing. So if you're feeling any of those kind of things, just soften your breath and kind of focus on inhale and out, exhale through the belly button area again. And hopefully you're starting to feel that neck area, if it was feeling tight, move a little bit more. And so we can bring that awareness more into the chest. So as we inhale, how much can you expand through the chest, through the front of the chest, the side of the chest, and through the upper back? Again, I want to inflate like a balloon. In any areas where you're feeling tension or density of that breath, bring that light energy of breath and see if you can softly, non-forcefully expand into it a little bit more. And hopefully as you start to feel that expansion of breath, let's bring that awareness of breath as a waterfall down your spine, filling up the bowl of your pelvis. As you breathe in, it makes your spine nice and tall, and you lift up as high as you can towards the ceiling. And as you exhale, you feel your spine soften and round a little bit. And as you inhale, again, let that trickle down the spine, fill up the pelvis, and lift you up nice and tall. And on the exhale, feel your spine soften and round a little bit. And notice that through this action of getting tall on the inhale, as you exhale, just feel everything soften like water rolling off your back. Feel that tension in your neck, the tension in your shoulders, just kind of get washed away. And just in this nice, soft space, just as a practice of gratitude, take stock of 1 to 3 things in your day, in your week, or in your life that just fills you up with immense gratitude. Whether it's a friend or an exciting thing that you have to do, your next vacation, whatever it is, let that sit and resonate a little bit in your heart as you're inhaling and getting tall and exhaling and softening. And when you're ready, go ahead and open your eyes.